Hello, and welcome to this special session called Why COVID-19 Testing Remains Critical for Underserved Communities. My name is Dr. Reed Tuxson, and I am privileged to be the founding member of the Black Coalition Against COVID and the former Commissioner of Public Health for the District of Columbia. I get to be the moderator for this great lineup of speakers. Just a couple of quick housekeeping issues before we get started. We want you to know that this webinar is being recorded, and if you would like to ask a question, please use the text box and we will answer as many as possible with the time remaining at the end of the program. So we do encourage you to be involved and engaged with us over the course of this program. While the federal response to COVID-19 under this administration has been strong, clearly more work needs to be done, and especially in the area of COVID testing. Underserved communities continue to be hit particularly hard by this pandemic, and we need to be attentive to the use of every possible tool as we try to fight back and save Black lives, in fact, save all American lives. Through the tireless efforts of trusted intermediaries, respectful community collaboration and engagement, and innovative technologies, we can continue to make progress. Over the next hour, our speakers will provide an overview of recent innovations and ongoing testing capabilities, along with specific opportunities for outreach, including through community health centers, higher education, and faith-based organizations. To begin our show, our first speaker today is Congresswoman Robin Kelly of Illinois. Congresswoman Kelly was first elected in 2013, and since that time, she has made an impressive mark as the representative for the 2nd District of Illinois, and she has become a passionate advocate on healthcare issues. Congressman Kelly is vice chair of the House Energy and Commerce Committee, and significant to this event today, is the chair of the Congressional Black Caucus Health Brain Trust. Through these leadership roles, she has a comprehensive perspective on the COVID-19 pandemic, its impact on medically underserved communities, the challenges and opportunities for enhanced testing, and ongoing federal response. Congresswoman Kelly joins us through a pre-recorded statement, and let's play that now.
Thank you for inviting me to join you today for this timely educational event. I am Congresswoman Robin Kelly of Illinois' 2nd Congressional District, and I serve as the chair of the Congressional Black Caucus Health Brain Trust. Health disparities are certainly nothing new. The Institute of Medicine's often referenced report, Unequal Treatment, was released nearly 2 decades ago. However, the ongoing COVID-19 pandemic has highlighted the significant impact of health disparities and the national challenges that stem from a lack of access to care. I have worked with my colleagues, including Congresswoman Wild, on a number of legislative efforts to respond to the COVID-19 pandemic. These efforts have provided resources for medical research, public health, and patient care efforts. I have introduced a bill to study the use of telehealth during the pandemic and look into how we can continue using this wonderful resource once the pandemic is behind us. We are working to enhance access to care, improve the health workforce, and address health disparities. However, much more still needs to be done. It is clear that to fully and completely respond to COVID-19, there will need to be a sustained national, multi-stakeholder, and almost personal response. In terms of testing, treatment, and vaccinations, no one can be left behind. Reaching underserved communities will require both dedication and innovation, as well as a full range of localized activities. I am interested to hear from Morehouse School of Medicine and Choose Healthy Life regarding their recommendations for ensuring that Black communities across the country are not left behind in our ongoing fight against COVID-19. I look forward to working with my colleagues on Capitol Hill and community stakeholders to continue to enhance and support the COVID-19 response. It is my hope that out of the tragedy of this pandemic, we can work together to build a more just, inclusive, and effective healthcare system that delivers high-quality care and affordable access for all.
Very good. We're very pleased to have that message and also the reference to Congresswoman Wild. And so joining us today also via a pre-recorded statement is Congresswoman Susan Wild of Pennsylvania. She is a passionate advocate for the 7th District of Pennsylvania and works tirelessly to promote public health and local economic development. She serves on a number of key committees that include the very important Education and Labor, the Science, Space, and Technology, and Foreign Affairs Committee. She has keen insights on the federal response to COVID, including the challenges that are facing our schools and also testing in underserved communities. Let's hear from Congresswoman Wild.
Thank you for inviting me to join you for this great event. I am Congresswoman Susan Wild from the 7th District of Pennsylvania. I am proud to stand with my colleagues in Congress, the administration, and community stakeholders to respond to COVID-19. Clearly, the ongoing pandemic requires a strong and collaborative response. During the pandemic, Congress has worked to enact a number of critical and timely legislative measures to provide economic relief for businesses and families and to ensure the public health response has proper funding and resources. More needs to be done, though. Our infrastructure, including our health workforce, needs to be modernized, and agencies like the CDC that form the public health safety net require ongoing investment. The COVID-19 pandemic has also emphasized health disparities, gaps in care, and difficulty accessing care for various communities. For these communities in particular, more needs to be done in terms of innovation and outreach. I am pleased to see such a strong panel assembled for this briefing to review challenges and opportunities as we move forward. Due in part to the federal response, testing for COVID-19 has come a very long way in a very short time. For us to finally defeat the pandemic through a variety of innovative tools and resources will be required. Testing solutions and outreach will need to be localized and customized to fit a variety of situations, from returning to school to reaching underserved communities. I am proud to represent the 7th District of Pennsylvania and so pleased to see that OraSure is part of this impressive panel today. OraSure has been part of the community for decades. In addition to investing in local manufacturing and job creation in Bethlehem, right here in my district, OraSure has also assisted with a number of public health efforts over the years, including Zika, Ebola, hepatitis, and HIV, by developing and helping to implement innovative testing solutions. Thank you again for inviting me to join you today. I look forward to working with the community as we continue to bolster the pandemic response and research underserved communities.
Well, thank you so much, Congresswoman Wild, and we really do appreciate your comments, and particularly your allusion to the strength of our panel. And so let's get right to it. Our first panelist today is Susan Van Meter. Susan is the Executive Director of AdvaMed DX, a division of the Advanced Medicare Technology Association, or as they are known by so many of us, AdvaMed, the world's largest medical technology association with over 400 medical technology member companies. They develop medical devices, diagnostic tools, and health information systems. AdvaMed DX and its member companies have played a central role in the COVID-19 response, working with federal agencies to speed the development and the implementation of essential testing technologies. Ms. Van Meter previously served as Senior Vice President of the Healthcare Association of New York State, where she was focused on hospital and health system policy, payment, quality, and health information technology priorities. She was also a very important member of the Center for Medicare and Medicaid Services Office of Legislation. Welcome, Susan Van Meter.
Thank you, Dr. Tuckson, for your leadership and for the opportunity to join you all today. So I'd like to say a little bit about AdvaMed DX's member companies and the work we do to continue to support our collective response effort, particularly in this latest stage of the pandemic that's characterized by this highly contagious Delta variant. So as Dr. Tuckson mentioned, the AdvaMed DX member companies, they manufacture for the commercial market diagnostic tests, and the laboratory platforms on which tests are run, and small instrumentation where tests can be run at the point of care, whether that is at the hospital bedside, in retail pharmacies and the like, in addition to tests that are instrumentless. And Dr. Tang from OraSure, I'm sure will talk much more about that. In short, diagnostic tests are key to screening for disease, to setting clinical pathways for patients, to monitoring treatment, are really quite foundational to informed clinical decision making. So too in the case of COVID-19. Diagnostic tests have been among the most important mitigating factors or mitigation tools that we have available to us today, and continue to be so. So when the pandemic began, there were obviously no diagnostic tests for COVID-19. Companies in the commercial market were able to rapidly develop tests and manufacture them at scale. And these tests are both diagnostic tests, so able to detect active infection. These are molecular tests, often referred to commonly as PCR tests. That's a type of molecular test. Also antigen testing. We have tests also that are able to discern evidence of prior infection for which an immune response has been triggered. So these are serology tests or antibody tests. And newer to the market are T-cell tests that are also able in a more granular way to discern prior exposure, again, for which an immune response has been triggered. When we think about the scope and scale of the mobilization, I can offer a couple of key statistics for you all. For molecular testing alone, the diagnostics industry for the US thus far has manufactured and shipped to our laboratory customers. These are hospital laboratories, public health laboratories, reference laboratories, and then point of care testing, retail pharmacies, skilled nursing facilities, and the like. We have shipped over 500 million molecular tests to date. Again, that's molecular alone. And we think about the augmentation of laboratory infrastructure. Our member companies have also contributed to its augmentation. We've seen about an 82% increase in laboratory molecular platforms. And I'll refer to this later because it's an important augmentation of infrastructure that we can use moving forward to help expand access to testing even beyond COVID. A few innovations have been really important to extend the reach of testing. I mentioned laboratory-based testing. That is really key for ensuring that we have large numbers of tests. So we have a lot of high throughput laboratory instrumentation capable of running hundreds of tests in a period as short as 1 to 4 hours. And then again, that point of care testing that's really been so instrumental, again, in making there be flexibility for how can we best serve communities, given the characteristics of communities, what kind of healthcare infrastructure exists. Point of care can really be delivered anywhere, particularly instrumentless testing. And we think about how samples are also collected. In the beginning, we really relied principally on those nasal pharyngeal swabs, very long swabs. We've been able to innovate. There are shorter swabs, much less invasive, and then oral fluid samples, which are much easier to provide. And if in the event where there had been a swab shortage, obviously that has been much ameliorated. We are comfortable with the swab circumstance now, but to have that flexibility of sample collection and oral fluid is really quite critical and important. And that innovation makes it easier for patients to be able to provide a sample. In addition to leveraging tests across all modalities, we've appreciated the opportunity to continue to support our nation's response. Earlier this week, we had the occasion to meet with leaders from the White House, HHS, CMS, and CDC, along with our reference lab colleagues, to talk about how to strengthen our collaborative efforts to continue, again, to extend that reach of testing. The school year is about to start. We know that there's consideration for booster shots. We really understand the importance now of surveillance testing to know and to help predict. And I'm really pleased to see the CDC is announcing a new data center to help predict increases in outbreaks. And we're looking forward to that collaboration. But one of the policy issues that we also touched on in this meeting earlier this week was not only how to best prepare for this school year and respond to this latest phase of the pandemic, but to think beyond COVID. This mobilization of laboratory infrastructure, of manufacturing capacity should be leveraged again for all diseases and conditions. So we think about that foundational nature of quality clinical diagnostic testing. We have an important moment in time to think about how can we best leverage that to make sure that all communities have access to critical diagnostic tests for whatever the disease or condition may be. And that's an important decision-making point for us all. And we look forward to working with our colleagues on the panel and policymakers on Capitol Hill and in the administration to help, again, in a permanent fashion, extend the reach of really critically important quality clinical testing. And I thank you again for the opportunity to join you today.
Thank you so much, Susan. Great comments. Let me ask you one quick follow-up question, and it really gets to one of the last points you made around this notion of working collaboratively between the private sector and government agencies to create this foundation, not only to be able to execute on what will inevitably be a dramatic increase in demand for testing in the coming days and weeks, but also building for the future. I wonder what your thoughts are for how do you sort of see that partnership, anything that we can be doing better in that partnership, and how do we sort of make sure that the equity lens is clearly involved in these meetings between the private sector and the government?
Yeah, that's a really important set of questions. So thank you for that. I mean, I do have to really commend our colleagues in the public sector. When in the beginning of this pandemic, I mentioned there was no test for COVID-19. The career staff in particular at FDA really worked quite tirelessly with industry to rapidly assess tests, to be able to get quality testing out on the market as quickly as possible, as safely as possible. And we were able, in the beginning of that pandemic, once a submission was complete, in some cases, the FDA teams were able to turn around a review in as little as 24 hours to help get those tests out onto the market as quickly as possible. So that kind of commitment to collaboration has really been essential. I think also some of the key collaborations that we've had with the administration within HHS, both BARDA and the Assistant Secretary for Preparedness and Response, as well as at the NIH with the RADx program, have allowed both large companies and smaller companies to get the kind of support that they need to either augment manufacturing or develop new types of tests, particularly for point of care testing. The RADx program has really been important. And I think that type of technology is again, really important to us, extending that reach of testing. You know, one thing I'd really like to see is us carry forward that infrastructure that I talked about, but also that notion that we can do more, right? We have a point in time now where we have over-the-counter tests for COVID that are available. That can make it as easy for you and I, all of us, to be able to secure a rapid test so we can, in a matter of minutes, really understand what is happening with our own health. And we should think about how we can leverage that in the future. I mean, to date, we've had only one over-the-counter test for infectious disease, that is the OraSure HIV test. Now I think we have this great experience, and we can think about how can we carry that forward, right, as part of that overall effort to extend the reach of testing. So those were just a couple of ways that the collaboration has been really important, and policy suggestions for how we might continue to extend that reach of testing.
Well, thank you so much, Susan. And again, I know that you personally and your company will always keep in mind the notion of all of America's communities and how important it is to reach out. So thank you for doing that. We have heard already the name OraSure, and so it is a great honor now to be able to introduce Dr. Steve Tang, who is the president and CEO of OraSure Technologies. They have a strong track record of supporting public health responses to infectious diseases. They launched our nation's first rapid test for HIV and HCV and worked quickly with government agencies to create and deploy a rapid test for Ebola. They have a history of working closely with public health to introduce easy-to-use self-testing solutions to reach underserved communities and engage hard-to-reach individuals. Recently, they have several emergency use authorization approvals from the FDA for its COVID-19 testing technology. Thank you, Dr. Tang, for being with us today, and the floor is yours.
Thank you, Dr. Tuxen, for the introduction. Let me make sure you can hear me.
Hear you well.
Okay, wonderful. Great to be with you today and the other panelists. It's especially an honor to follow Susan Van Meter from AdvaMed, who spoke so well about the industry situation and opportunity. And I also want to offer my special thanks to Congresswoman Kelly for her work in leading the Congressional Black Caucus's Health Brain Trust. And I also want to thank and recognize Congresswoman Wild, who's been so proactive on this front as well. At OraSure, we are proud and grateful to have her representing our district where our corporate and manufacturing operations are based. We appreciate both Congresswomen for sharing your voice on this important topic. OraSure Technologies has a long history of collaborating with public health. Together, we've developed a simple, accurate point-of-care at-home test for infectious diseases such as HIV, hepatitis C, and Ebola. So we obviously have experiences in pandemics of the past and present. Our OraQuick HIV self-tests, in fact, have helped millions around the world learn whether they're infected and have helped connect them to care when needed. I'm honored to be here today as we talk about the current landscape of COVID-19. In March of 2020, when the entire world was on lockdown, OraSure embarked on a mission to develop a simple COVID-19 test that could be used by anyone, anywhere, without the need for a laboratory, the internet, electricity, or a medical professional. Our IntelliSwab rapid antigen test delivers against that mission. This June, we received 3 emergency use authorizations from the FDA for over-the-counter, professional point of care, and prescription home use. At OraSure, we have learned from our work with HIV home tests that simplicity and ease of use are paramount to self-testing success. The fewer steps users must follow, the more likely they are to administer the test successfully and have confidence in their results. Our technology requires 3 simple steps: swab, swirl, and see. I'm sharing this with you because COVID-19 has disproportionately impacted underserved communities. Simplicity is what makes the IntelliSwab particularly well suited for communities that lack a robust healthcare infrastructure, whether those neighborhoods are in rural mid-America, the mountains of Appalachia, or in our urban centers. The test also works well for those who may struggle with technology, such as some, but certainly not all, elderly folks. And if my 85-year-old mother is listening in here, I'd like her to know that I'm not talking about her. Right now, we're watching the Delta variant surge, particularly in places where vaccination rates are low. Unfortunately, vaccination rates are lower in underserved areas of the country. COVID-19 testing will continue to play a crucial role in detecting outbreaks and mitigating the spread of the virus. We need to be certain that every American has access to fast, accurate, convenient tests, not just those in our affluent and middle-class communities. OraSure's IntelliSwab is ideally suited to address the testing needs of not some, but all of our communities. And we as companies stand ready to help our nation address this pandemic as it continues to twist and turn. Thank you, and it's wonderful to be here, Dr. Tuxen.
Well, thank you very much, Steve. Let me follow up on 2 quick questions that people may well have, and they're really related. And that is, number one, do we need to be concerned as you look at not only your test, but at the marketplace in general? We need to be concerned at all about the accuracy of our new tests, particularly those that are over the counter, such as the one that you make? And related to that, do we need to be worried that as the variants change and we now have the Delta variant, that will cause the tests to be more, to be less accurate? So can you help us to understand a little bit about accuracy?
Yes, those are 2 very important questions, Dr. Tuxen. So let me answer the first one. The fast and frequent testing and that is what the FDA calls serial testing for asymptomatic people. That is testing routinely, even though you don't have symptoms of COVID-19. That is proven to be as accurate as PCR testing if you do the test as they're directed. In other words, take one test and then test again within 24 to 36 hours. So if you do and follow that protocol, then you'll be in a window where the likelihood of false positives or false negatives is minuscule. So we've solved the accuracy problem by having serial testing. To your second question, the Delta variants and really all the variants have to be retested by test manufacturers like OraSure routinely to make sure that the effectiveness of the test is maintained regardless of the genetic drift of the virus. And so each of the manufacturers of rapid tests has that on their list of to-dos as part of their emergency use authorization. And OraSure is certainly doing that with all the variants that are available. We will have something to announce hopefully shortly about our efficacy there. I think we are very confident that we have a test that's resilient against all current variants and hopefully all future variants.
Thank you so much. I hope you'll be around for some of the other questions if you get a chance. Thanks so much for joining us. I am really pleased to introduce a stellar leader in healthcare today, and someone who I consider to be a long-standing friend of many years. Dr. Elena Rios is the president and CEO of the National Hispanic Medical Association, where she represents 50,000 Hispanic physicians in the United States with a mission to improve the health of Hispanics. She also serves as president of the Association's National Hispanic Health Foundation, where she directs educational and research activities. In past life, she was a significant member of the United States Department of Health and Human Services and has numerous awards and acknowledgments and appointments that attest to the fact that she has established a career as a major leader in American medicine. Dr. Rios, thanks for joining us.
Thank you, Reed. I'm very happy to be here, very honored to be here with such a stellar list of participants. And Dr. Tuckson, you outshine all of us with your leadership and bringing everybody together in the community, as well as with HHS and OraSure and the other companies. I think I just want to say that NHMA has been, National Hispanic Medical Association has been partnering with OraSure on the importance of especially the more innovative, simpler home testing for our communities. And I think what's important to know is the Latino communities, the African American communities, Native American, Asian, all of our rural and disabled, all of our vulnerable populations need extra policies dealing with outreach and dealing with our community health workers who come from the community, who know how to persuade people and let them know how important it is to get tested for COVID-19 and to help with stopping the onslaught of this horrible disease that's really been a burden economically and as well as mentally on our most vulnerable communities. So I think that the important message that I can say is that the National Hispanic Medical Association is working with other groups. We have a Hispanic Health Professional Leadership Network. We have chapters. We have councils of young physicians and residents, medical students. And also we're working with our sister organizations, the NMA, the National Medical Association, the American Association of American Indian Physicians, as well as the NCAPP, the National Council of Asian Pacific Islander Physicians. And the Association of Black Cardiologists, who form what we're calling the Alliance of Multicultural Physicians. We've been working together for a long time, but I think through COVID-19, we've recognized the importance of the of a united front in getting the messages out to all of our patients and families that doctors see. And the leadership of the doctors is incredible when it comes to hospitals, clinics, nursing homes, and all the places where you need that extra culturally sensitive testing messages to get more people tested. And I guess the last thing I'll just mention that you know, just like everyone has said, it's so important to collaborate, and we've collaborated with White House and all of the national groups that are being brought together through the White House. And the Biden administration has done a great job in building the collaboration, also meeting with the Secretary of HHS and CDC and CMS and the Assistant Secretary for Response and Preparedness about all the different treatments needed. But I think what's most important is that the reach to our communities needs to be expanded. And one of the most important ways in public health is to have more leaders that are like us, that are Black and Latino and Asian, Native American. And I can't say enough about the importance of having mentoring and coaching of young kids in grammar school and middle school, high school, that they can become doctors and nurses and public health leaders. And we really need to focus on the importance of that message, because we've been flatlined since the 1970s. Doctors in this country that are Hispanic or Black are only 5% of the total doctors. You know, we represent doctors to the AMA, but it's just, and we work with the AAMC and all the medical schools. But I think it's really within our own families and within our own teachers and counselors who do not know how to encourage and motivate our students to become doctors and nurses. So it's really up to us. We're the alumni of medical schools and public health schools in this country, and we need to do more to get the messages out in our communities. And I'll just end with how important it is to be a part of this and to know how important COVID-19 has really opened the eyes of our communities that are most affected to death and hospitalizations in our families, and how I think there's you know, it's been a real turning point for our communities, and health equity is here to stay. We need to do more to be leaders in the fight against COVID-19. So thank you very much.
Thanks so much, Elena. Really appreciate it. I have one quick question for you, but as I set that up, I just want to underscore an incredibly important point that you've made. You know, in a time in America where there is this entrenched tribalism, segmentation across the American landscape, everybody in their own corners with their own special uniforms on, it is important that you made this observation that our minority health professional organizations have come together, are working together, trying to advance a pluralistic, harmonious nation where our combined firepower of all our medical leadership has come together as one. And so therefore, people of color can trust the advice and the guidance they're getting across the board because we are all using the same science, the same evidence, and we're working together. I think this is something that America needs to appreciate, participate in, and celebrate. In that regard, as you think about testing, Dr. Rios, you have been teaching me ever since the beginning of the pandemic some of the challenges that there has been in the Latino community, among many other communities of color, in accepting the guidance and the science about vaccination and mask wearing and so forth. Are we seeing the same kinds of challenges here in COVID testing? And are there going to be some special initiatives that we're going to need to do to enhance the uptake of the testing devices that are now available?
Yes, the answer is yes, of course. I think the attitudes and perceptions of Latino people, especially younger, just like everybody else, you know, they're invincible, they're hardworking, and they don't take care of themselves. I mean, everybody knows that we take care of our families first and make sure our children are healthy, and you know, the husbands get to work on time, and the children get to school on time, and mothers don't take care of themselves, or you know, vice versa. Husbands don't take care of themselves. They're worried about working and not missing work, and they don't have family and paid medical paid leave. So there's so many excuses, and I don't think people really understand. The Latino community does not understand that getting tested and getting vaccinated is going to help their families and themselves. And I just think that we have to have more outreach, continued outreach with community health workers, continued outreach at the doctor's office and the pharmacies, and even in the churches and the supermarkets where people congregate. I think it's so important that we have a public health that is outside of the public health system, and health motivation for being healthy, that begins with testing. If you have a symptom, or if you're in a large crowd where people are sick, I mean, you have to get tested.
Good. Thank you so much. And we'll have a few more for you, I hope, in the question and answer period. Now it is our excited enthusiasm to introduce Dr. Michelle Nichols of Morehouse School of Medicine. I mentioned that I am one of the co-founders of the Black Coalition Against COVID. That is comprised by the 4 historically Black medical schools: Howard, Meharry, Charles Drew University, and Morehouse School of Medicine, along with the National Medical Association, the National Black Nurses Association, the National Urban League, and the blackdoctor.org organization. So it's a pleasure to introduce our sister from Morehouse, Dr. Michelle Nichols, the Associate Dean for Clinical Affairs and the Medical Director for Morehouse Healthcare. Throughout her career, she has exhibited an impressive advocacy for health equity and has been working diligently on the front lines of the fight against COVID-19. She serves also as the medical director for the Morehouse School of Medicine MHC Community COVID Vaccination Program in Atlanta, Georgia. Her story was featured on CNN and Becker's Hospital Review as 6 Black women who have been on the front lines of the fight against COVID. And so she has really been honored for her work, as she deserves to be. Thank you, Dr. Nichols, for joining us, and we're interested in your perspective.
So first of all, I want to thank you for the invitation and the opportunity to present before this outstanding panel group. I am Dr. Michelle Nichols, and I am here on behalf of Morehouse School of Medicine. I bring you greetings from our president, Dr. Valerie Montgomery Rice. At Morehouse School of Medicine, besides what Dr. Tuckson just mentioned, I am a family physician. So according to the CDC, the COVID-19 pandemic has brought social and racial injustice and inequity to the forefront of public health. Unfortunately, it has also highlighted that health equity is far from being a reality, since COVID-19 has unequally impacted many racial and ethnic minority groups, putting them at greater risk for infection, hospitalization, death, access to testing, and vaccination. These findings are not a surprise for us at Morehouse School of Medicine, since we are on the front lines in leading the creation and advancement of health equity by engaging, educating, serving, and providing healthcare and research in communities of color. When the opportunity presented ourselves in December of 2020 to become a community vaccine provider, Morehouse School of Medicine became a very early adopter. Based on our commitment to health equity and being a trusted entity within the African American community, both healthcare and research, we knew that we must tackle the hesitancy, mistrust, misinformation, and myths that are so often associated with not only the vaccine, but also the novel coronavirus in general. Leading by example and being early adopters was also applicable to us in the early phases of the COVID-19 surveillance and diagnostic testing among our community in the early phases of this pandemic, and has continued to our most current surge of this pandemic. Since Morehouse School of Medicine is one of, as Dr. Tuckson said, one of 4 HBCU medical schools, we are a trusted entity in the communities of color and a trusted resource for our Atlanta University Center Consortium, which is our brother and sister undergraduate schools, which are Spelman College, Morehouse College, Clark Atlanta, and Morris Brown, where we provide student health services to the entire AU Center community, as well as our own students. This includes us developing a playbook well over a year ago on recommendations for asymptomatic and symptomatic testing, both the PCR and the rapid antigen test, monitoring through publicizing a weekly dashboard, development and management of isolation and quarantine policies and protocols, contact tracing using our own public health students in a partnership with the Department of Public Health, vaccinations, and also doing a return to campus and a continuous monitoring program and oversight. We have found that regular routine asymptomatic surveillance testing is a safety screening measure to help us better understand the prevalence of COVID-19 in our community, which includes your schools, your local, your state, and your national, to help reduce this silent spreading of the COVID-19 virus and to support planning efforts to returning to school and work and to help limit and reduce the interruption of in-person learning. In addition, COVID-19 surveillance and diagnostic tests help us guide us on the strategies for safety, mitigation, and management of COVID-19. We've learned some lessons through both testing and in providing our own types of vaccinations. And so those things that we learned were impact trust by engaging the community and being a part of the community, as well as having providers who look like us, just like Dr. Rios just said, sound like us and have similar experiences and backgrounds. Provide information and education to dispel myths and misinformation, and to educate on testing and vaccines through panel discussions, PSA, social media, whatever means necessary. And we also need to ensure that this material is multilingual, multimedia, and appropriate for the educational levels. We need to meet people where they are on this journey for both testing and in vaccination. And as for our younger people, our adolescents, we need to engage both the parents and the children for those that are under 18 and to help them resume some type of normalcy again, to come up with a plan for not only testing them, but vaccinating them with incentives, such as a couple of weeks ago, we partnered with the local YMCA to provide book bags and to also provide information for our young people. As far as testing, we need to have both test kits and vaccines in primary care doctor's office, like we have at our clinic, because doctors are trusted entities within the community. And we need to have vaccines available wherever we do testing. So we should never waste an opportunity to test, educate, and vaccinate. We need to travel where the vaccine recipient is and make it so convenient for them. Last weekend, we went to a park and we vaccinated the homeless and also provided food and toiletries for them. And we need to stay focused on the goal so we can educate and meet people where they are. Memorial School of Medicine, because of our mission, is uniquely positioned to help boost testing and vaccination rates because we are viewed as a trusted source of COVID-19 help within our communities. So first of all, I want to thank everyone for the opportunity and to share our views with you. I am pleased to respond to any questions that you might have.
Thank you so much, Dr. Nichols, and we will get back to you with those questions, and people can certainly put those in the chat. But I want to move now to to Nicole Fields, who is literally also, like Dr. Nichols, on the front line of the effort to reach underserved communities. Nicole Fields is the president and CEO of the St. James Federally Qualified Health Center in Newark, New Jersey. A graduate of Seton Hall, Ms. Fields has dedicated her career to enhancing healthcare in New Jersey and building the St. James Federally Qualified Health Center into a high-quality care center dedicated to serving those with the greatest needs. Nicole, thank you for what you are doing, and thank you for being here with us.
Thank you, Dr. Tuckson. I want to thank everyone for including me today. I'll tell you all a little bit about what St. James Health has been doing the past year and a half in response to COVID-19 and some of the partnerships that have made it possible to serve the city of Newark throughout COVID. Since March of 2020, St. James Health has done over 40,000 COVID-19 tests and given out over 27,000 vaccines. At some points during our first peak, we did over 500 tests a day and had over a 35% positivity rate on our tests in one specific zip code. Here in Newark, we've seen another jump in the need for testing over the past few weeks, with our main site going from 50 to 60 tests a day to nearly 200 a day, and our positive cases slowly creeping back up. To accommodate the increase in need for testing, we had to pull testing outside of our health center in a specially outfitted sea container located directly outside our door. This allows us to keep our staff and regular primary care patients safe and seeing their doctors inside the health center while still meeting the needs of the community. For vaccines, we host 2 school-based sites each week, and we do pop-ups in neighborhoods around the community every single week. At our pop-ups, we do fun things like have ice cream trucks to get the community out, talking to our providers, and having the conversations about COVID. Anywhere we're offering COVID vaccines, we are also doing testing and making sure we have community health workers available to talk to the community. We have certain situations where rapid tests are needed due to large numbers of people living or working in small spaces. So we need to make sure the supplies are still coming into these underserved communities and areas and to community health centers over the next few months. Many people feel that testing is much more widely available now than it was early on in COVID. And in some cases, in some areas, that might be true. But a lot of that testing is being done in private facilities and urgent care centers where there's a cost associated with the test. And here in Newark, many of our patients are unable to pay that cost for the test, and they still need the test. Especially if there's large families, we can't ask them to be paying any sort of cost for the test. The work we have been doing would not be possible without our partnerships. One of our best partnerships throughout the pandemic has been with Metropolitan Baptist Church, which is a part of the Choose Healthy Life Network. And we've been able to set up a testing and vaccine site at their Willing Heart Community Care Center. This partnership and location has really made us able to reach a population we would not normally have had access to. I'm also extremely proud of the work that has been done in Newark throughout COVID. Our mayor has really been a forward thinker and used resources outside of the normal health system, such as the Public Safety Department, which gives us access to manpower to help us set up our sites, take down our sites, and assist us with intake at vaccination events. It also has allowed us to test citywide over 330,000 people since March of 2020, and we're still going strong. This partnership is mostly made up of the Public Safety Department, the City Health Department, and private labs that the city has been using throughout the city. Test sites are located all over the city of Newark in schools and on certain street corners, and the communication with the city has been phenomenal. The mayor gets on a Facebook Live every single day to go over COVID numbers, testing, vaccines, and anything else that the community may need to know.
Great. By the way, thank you for that, Nicole. And I've gotten a note from one of our panelists who reminds us that urgent care sites are not to charge for COVID tests. The CARES Act covers that that cost. So I think that's an important point to make as we go forward.
Yeah, I think yes, the CARES Act, it should be covered, but I think if you drive around certain areas, you do see the signs up that people are being charged. It might not be the right thing to be, and we need to stay on top of that. That is something we need to
got to get that word out for sure. Nicole, thank you for raising it, and Susan, thank you very much for giving us that input. Well, to close out our panel, I am really pleased that my sister in the struggle, I think she's everybody's sister in the struggle, and that's Deborah Fraser-Howes, who for most of us needs no introduction. She's been a part of numerous public health fights, dedicated her life and career to promoting health equity in underserved communities. She created Choose Healthy Life in 2020, modeled on her very successful work with the National Black Leadership Commission on AIDS, which she founded in 1987. Her organization is co-chaired by Reverends Al Sharpton and Calvin Butts, focusing on promoting and deploying COVID testing and vaccination services in faith-based communities. She is one of the great sheroes in the fight. Dr. Deborah Fraser-Howes, take us home, please.
Oh, thank you, Rita. Thank you so much for being here, and thank you again for your leadership. I also want to thank Congresswoman Wild and Kelly. The community is very, very grateful for the work that they're doing in this area, and we need people in Congress to support us and help protect us. You know, Choose Healthy Life started in response to what was called testing deserts. They were primarily in the Black and Latino community, and they were in these communities in New York and Detroit and Newark and Atlanta and Washington, D.C. And we created Choose Healthy Life with Quest, in partnership with Quest Diagnostic, to fund 50 churches across these 5 cities to hire public health navigators on the ground and set up testing sites
so that the Black community would have access to the testing that they needed. It was so tragic to see them putting body bags in the backs of freezer trucks that we know contained our people, and with no ability to respond. And the only way that we had to respond at all was to ensure that our community had the tools to know their status immediately, and make rapid, informed decisions. You have to know that you're infected so that you don't go home and infect your family. And that was a critical piece then. Enter the vaccines. This was all pre-vaccines. Enter the vaccines, and now we pivot because the vaccines are critical pieces. And we know that vaccines are going to keep our people in our community alive. So we got funded by HRSA to expand from the 50 churches and the 5 cities to 118 churches across 13 states. So we are now in the throes of ensuring that these churches have their public health navigators, and we're reaching communities like Aiken, South Carolina, and Waycross, Georgia, and places that we know we have to get into and get on the ground and get scruffy so that we can get these people together and get them all vaccinated and tested. Testing is still critical, particularly in communities of color. And we're talking about all kinds of tests, lab tests, but rapid point of care tests for communities that usually get their information about their health status either in emergency rooms or health fairs or things where you have to meet, places where you have to meet them where they are. Having rapid tests become critical. All tests are critical. So we need to ensure that there is some focus on testing within the public health community, meeting people where they are in the communities, and that's particularly important for the underserved. Funding for testing is critical. Giving our people, again, the power to know their status and make informed decisions. Without the funding, it just does not happen. And whether they shouldn't be charged for tests, but the funding has to go in the community, and it has to go to where the community exists. Just throwing money at it is not going to solve the problem if you don't have people there that people trust and will go in and say, okay, let me have a test or let me have a vaccine. Funding for community organizations is thereby critical. So CDC, NIH, OMH, and all of these other people who are making these decisions and investments in public health has to see that testing, and we need all types of testing, is localized, customized, and we meet people where they are, and we get them tested and we get them vaccinated. We can no longer let our people die disproportionately from these pandemics. No more. This is absolutely over. We're ready to save lives, but we need the tools in order to do it. And testing and the vaccines are part of that tool. I want to just end with saying that, you know, I heard everything that all of my partners said on this webinar, and they're all great and they're all right, and I agree with all of them. But we have become the embodiment, the actual physical embodiment of everything that everybody has recommended, being on the ground, having the clergy speak to the community, getting them vaccinated, getting them tested. So vaccine hesitancy in our community and testing, it was at an all-time high. People believe that you know, that somebody's going to take your DNA if they test you. You know, that there are as much misinformation about testing as there is about vaccines. But people understand that, you know, you need to know your status before you go home and kill everybody in the house. So we've got that across them, but our people are hesitant for very good reason. I mean, everybody talks about Tuskegee, but it's not just Tuskegee. We've just not been treated right in the healthcare industry. So our people need the tools. The people need to know their status. People need to not come back to this anymore. So like Dr. Rios said, we put together, we're working with you and the COVID Black Coalition, the NMA, Black religious organizations, and a host of other organizations to come together for this massive 118 church attack on getting our people what they need to keep them alive. So we've also within that are looking at the formation of something called the Never Again Coalition, because never again can Black communities allow themselves to die at this rate. We need partners, federal, state, governments, and industry. Industry is going to be critical. They gave us the test. We couldn't get the test from anywhere else. Industry had to come together. It's their innovation that allowed for the test to even be available. And we've got to allow all of these partners to come together as one to save a community that desperately needs to be saved, deserve to be saved, particularly in the political environment that we've just come out of.
Well, thank you so much, Deborah, for that, and for all of our panelists. Let me just sort of quickly summarize in the last 2 minutes that we have available. Number one, the real message here, again, from everyone who has spoken, is that equity is important and that we have to look at every step in the continuum of this pandemic fight and the future healthcare fights through the lens of equity and fairness, and making sure that programs reach everybody, particularly those most in need. Number two, I think we have firmly established that we need to have funding available to community-based organizations like Choose Healthy Life, other federally qualified health centers, and others, so that they are able to do the work that they need to do. Number three, I think we have clearly established the viability and the essentiality of public-private partnerships working together. And that is very much demonstrated in the testing environment. And so we celebrate and applaud all of the private sector people who have been on this program working with us together. Then we also want to make sure that we are helping our community have access. I think that what we heard from Morehouse and the work that they have been doing, they have worked so hard on creating access to testing and vaccination services, as have other members of our panel. And we need to be really focused in supporting those who are providing that. But I think there's one other last step in the continuum that I would urge us to be attentive to, and that is helping our community to be educated, to be competent in using the tests, knowing when they need to be used, and how they can help us make personally appropriate choices. It's not good enough just to have these out there. And now that we know there are so many over-the-counter tests, we're going to need to make sure that we educate our community to be able to be sophisticated in using them properly so that the results will be meaningful. So there are multiple opportunities going forward. And I think we ultimately will have to come back to, are the resources going to be there to make sure at this critical moment that we will have the chance in minority communities to have a ready access to diagnostic testing and in good capability to know how to use them. Thank you all for joining us. This program will be rebroadcast. And I think in the chat, they may be putting in the address for that. But on behalf of all of our speakers today and the organizers, thank you so much for joining us for this important topic. Let's keep putting the pressure on in every way we can to fight this pandemic. The next few days and weeks will be determinant for so many lives. This Delta variant has gotten very good at learning how to kill. We have to be very good at learning how to kill it. Have a good day to everyone.